Hello everyone and welcome to Podcast by Nirvana Canada, where Team Nirvana brings together real conversations with real business leaders, entrepreneurs and professionals. No fluff, no theory here. Just first-hand insights from people who have built their success through grit, hard work, smart decisions and years of dedication to their craft. These are the stories of people who have created trust, built strong reputations and carved a niche for themselves through consistency and vision. And today, we are joined by someone whose profession is all about creating smiles. A respected and popular dentist from Coquitlam who, with his own warm smile and commitment to patient care, has helped thousands of patients or rather thousands of people smile with great confidence over the years. So let's welcome a professional who has not only built a successful dental practice, but also built lasting trust and comfort within the community. Let's pass it on to Dr. Reza, the famous doctor behind Sunrise Dental Clinic, a popular clinic from Coquitlam behind thousands of happy smiles in the Coquitlam city and beyond. Dr. Reza, most welcome to our podcast. Let's start with, please tell us about your journey. As I have noticed, Sunrise Dental journey is connected to you and it's truly inspiring, I must say. But please take us from where this journey started and how it started, please.
First of all, let me greet to your audience, Vishal, and I say hello to everyone, and I thank you for inviting me, and
Pleasure.
Thanks for giving me that credit by those compliments you told me. I'm very happy that I'm here and I can give some information about my journey
Please.
and my story. I'm originally from Iran. I came to Canada in 2007 with my family. I had like my son was like less than 2-year-old back then. And I went to UBC Dental School for a 2-year qualifying program back then. And I got into UBC at 2008 and graduated with the class 2010, and then I started my practice. I took over almost a brand new practice in Coquitlam, and since then I've been working there for like 16 years.
Wow.
Before I come to Canada, I went to my hometown, Mashhad Dental School, for 6 years to take the license of dental faculty.
Wow.
And I had my own office there too. So this journey was started since 1997 as
Wow.
a dentist towards now.
Wow, 29 years. Oh wow, and
Yeah.
and almost 18 years in Canada.
Yeah,
Amazing.
almost
19 years.
more than half of my age.
Oh yeah, actually more than half of it. That's wonderful. So Sunrise Dental is now a fairly popular name today. What do you believe were the key turning points behind this success? What has really brought this success?
I think it's it's not easy to answer this. There are many factors. It's multifactorial.
Yep.
If I want to make it simple and like understanding, I would say it's like a pyramid. So the entrepreneur, in this case me, is at the top. So we need to make like a team. As a team, we can just make everything on a right way. So to me, the first thing is important is knowledge. So all dentists that working there should be knowledgeable, and their knowledge should be updated.
Truly.
The second one is equipment. So technology is a very, very important role in this game.
It is.
And the second one is the staff. We have to make like a warm and welcoming atmosphere to have patients on chair like happily and to say goodbye to patients happily. So this is the secret. We have to say hi, goodbye, in the same way, they have to be happy and leave the office with a smile.
Wow, that's so I now get it. That's your motto of giving smiles to people by greeting them well, by sending off well, so that they keep smiling always. Amazing.
Yeah.
My next question would be: many businesses, these days today focus on revenue and expansion. What has been your personal philosophy while developing your organization?
To me, these days, healthcare is not at the same as before. There are many competitions these days.
Yep.
So we have to be like professional at healthcare and business. So as a dentist and businessman, I had like a plan for my business, I would say.
Wow.
And yeah, money is not very important, secondary, right? But at the same time is important.
It is.
Because we have to treat our staff and team members as well, right? So I took care of both sides at the same time, and it worked.
Amazing. So you touched upon a point that it's a business. That's right. Many people in general consider doctors as healthcare professionals, but a healthcare professional like you who has started a business now, they have to run a business. As you said, you have money is important. You said, though it is not the paramount thing, but it's certainly important because that keeps the show running. So tell me honestly, do doctors remain just doctors, or they even become a doctor entrepreneur today? Because they also have they have to act, they have to take care of patients for sure. That first focus is patient care, but then they have to run the business. They have to earn money as well. So that compassion, care with the interest of earning money, how do you balance it all?
Doctors wear multiple hats these days. So as I said, we have to keep an eye on healthcare part and another eye on business,
True.
Because entrepreneur has to grow.
Certainly. Yep.
And grow as a team.
Yep.
You need to be very aware of everything.
Can't agree
The
more.
money that come into the business, stay in the business to make the business first powerful. It goes inserted into ideas, many study clubs to make the knowledge updated. It goes to a stronger team as helpers. It goes to new technology. It goes to new everything in this era. For example, these days social media is important. These days social marketing is important. And speaking of social marketing, I have to thank Vishal and his team at Nirvana for helping us in that regard.
So kind of you, sir. So kind of you. You touched upon a very good topic that you need money to make things work, but I believe it is about serving the community as well. You said you're from Persia, you're from Iran. How important is that community role here in your success?
A lot. If you know culture, you can play with them right. And each culture has its own secrets. Persian people are very hard and difficult to deal with at the beginning. But down the road, when they get trust, they are very, very, helpful, very friend, and very promoting your business and your dental office. I keep saying business because, these days every service is paid by itself, right?
True.
So in healthcare, even in healthcare, we have to survive. So Persian community is a very good community to work with, and you have to be very careful at the beginning, but down the road, if they get trust, they would promote you to everyone, and you get grow very fast from a certain point.
Amazing. So this confirms the fact that community helps. So as you see here, Dr. Reza said that community has helped. So I'm sure every community, when you serve the community, that serving comes back to you. Moving on, doctor. I always had this, I'm always scared of going to dentist. I don't know why. But and dentist, I feel, when they put that equipment in my I feel scared. So how do you as a doctor give people that confidence that you make your people comfortable, you make your customers comfortable that they come to you, or your patients comfortable when they come to you? How do you do that?
Good question.
One thing I know, you have a very good smile. Your smile gives a lot of confidence. But I'm sure, somebody who's scared like me, maybe next time if I walk into your clinic, how would I be comfortable?
Thanks for asking that question. It's a good question, actually. As far as I'm concerned, most of fear in dentistry is in three categories. The first one is pain through injection, like needles.
Yep.
The second one is the voice that those drilling devices make. Yeah. And the third one is stress that comes out of financial issues.
True.
Because dentistry is expensive in Canada, right?
Yep.
So I manage in this way for the pain and drilling sound. I usually take time and patiently talk to patients, make them calm and show this stuff to them and make the fear in their brain and mind smaller.
Wow.
Because it's an imagine it's like a image in their brain that grows and made it like big. So if you give them right information calmly and tell them right about those knowledge, they get the different point of view.
Wow. So what I understand is you're saying that you give confidence to your customers by giving them the complete knowledge. They know upfront what is going to happen, what equipments, what things are going to happen. So they are more aware. When they're aware, the fear goes down.
Exactly.
Oh wow, that's
and the third part, which was like a financial issue.
Yep.
We usually listen to their concern if they have any and make the treatment plan very productive to them. Wow. It means that there's like a source of finance for them and they need like a treatment. So we go through those priorities first,
right?
And we make the paying like bills by installment. We help them like financially by making into small parts for them to get. I hope I answered your question.
Oh yeah, in fact, this is a new thing. So what I understand is that if I come to you tomorrow, if my treatment is big amount, I can pay in parts.
Yeah, there's a third company actually helping us as a sister company to make like financially helped patients. And Sunrise Dental sponsor its own patients by paying interest to that company for the first year.
Oh, amazing.
Yeah.
I keep pushing my treatment, but now I think I can take it up. Oh, thank you. It's great. I'm interacting with you today.
I'm in your service.
Yeah, certainly, sir. I look forward to coming over. So, you are a dentist, and I'm sure as a dentist doctor, you may not like to share your trade secrets, but it is very important for viewers to know, for multi-viewers to know, what are the best steps for dental care or dental hygiene so that people don't have to visit dentists that often. What would you suggest?
It's a good question too. Thank you for mentioning that. I always tell my patients, please don't afraid of dentistry. Come on a regular checkups and regular cleanings, so those small problems doesn't get worse.
Okay.
And also at the same time, we can avoid huge investment on dentistry by you. So we can stop problems at the very early stage, not to get worse, not to get expensive for you. So I recommend a routine of properly brushing and flossing.
Right.
And I recommend routine checkups and cleaning.
Okay.
And having like more concern about those regular things that I told you.
Oh, amazing. So it is being regular with your dental hygiene is the key to avoid any major challenges?
Exactly. Prevention is better than treatment.
Sure. Prevention is better than cure, gentlemen. So this is the mantra from doctor, and that's what most doctors say, and Dr. Reza also said so. I believe we must need to take care of dental hygiene, because as age progresses, these things makes a lot of challenges, and I have faced it in my family. When it becomes complicated, it is not just painful, it is very expensive as well. So be proactive about it, and I'm sure that'll pay in the long run. So moving on, doctor. In today's digital world, okay, let's move on. Before I move on to the digital question, I would like to know, you have had a long journey in dentistry. Can you spell out any tough moments you had?
Oh, many. At the beginning, when I came to Canada, cultural shock.
Oh,
yeah, it's different. I came from eastern part, like from Middle East to Western countries, and culture is so different.
True.
Here, people are more like needs privacy, but in Eastern countries like East India and Iran, people just talk together, talk to strangers. So it was like many cultural shock at the beginning, and because I was like so fast going into dental faculty, my English was like a concern as well. Sometimes I couldn't take some important points when the instructor telling us like some instructions. So language barrier was a little bit, and after I got graduated, I took over a business here, and business was different from Iran too. And mostly my concerns was how to manage my staff at the office, how to manage my family to be relaxed at the same time without much of concern, and to manage everything regularly. And for a dental office, the most important concerns back then was how to financially survive, and how to manage your staff as a team leader. So I wanted to show myself as a strong leader. At the same time, I had to do dentistry for my patients in the best way. I had to, I worked 5 days, sometimes 6 days a week, and I had to manage my energy to have energy enough at home with my family to survive as an immigrant. So it was really challenging at the beginning, but we survived, and through those challenges I got like stronger and stronger, and these days even bigger challenges is like kind of fun for me, so I like to go through that.
Wow, when going gets tough, the tough gets going.
Let me add something here.
Please.
I want to share something with the audience.
Yes.
I'm opening my second office, more than twice expansion. It means that the second office is my dream office.
Wow.
We have like 9 operatory chairs. We have
amazing.
like a specialty clinic and general practitioner in one place for patients to have like the best and to take the best advantage of it, with a very amazing price, very reasonable price, even for a specialty, and my staff live in a second home as a dental office, all together in a comfortable space. I like to have some like spaces for them to live in the second home. And this office is full of challenges, but I like challenges, and I know I can make it, and I'm happy in advance.
Wow. Second office, double of the size. Amazing. And challenges, I'm sure, the challenge which you mentioned, you must be facing still challenge, because I know you work still almost 7 days a week. We interact at times on Saturdays and Sundays as well. We receive emails from you. So you're always working. So that's one way is good to serve your customers as well. But how do you find time for yourself?
How do I think what?
Time for yourself.
Time for myself. Oh, actually, let me tell you something, and your audience. that I'm not working 5 days a week at this moment. I'm only working 2 days a week. And because I mentioned about the teamwork, the team grow by itself, right? So we have like 6 dentists working at the same office and 2 hygienists. 2 of those 6 dentists are they are specialists back home in Iran and general practitioner here. So we have an orthodontist and we have like oral maxillofacial surgeon as well. So we work like almost 7 days a week, and very productive, very busy office, and I'm taking care of like management mostly.
So you're a leader, you lead them.
Yeah, and I work 2 days a week on to help my patients, because some patients wants just to see me and I'm always available for them.
Amazing. Moving on, Doctor, I saw a lot of strong digital media for your business. You invested heavily in that, and you whenever we interacted, I get to hear that you're very, very invested in that as well. What prompted you towards or pushed you toward digital media?
Good question. I used to be kind of old school, and I didn't believe in social media, and I was so shy to go in front of camera.
But you're not anymore.
Oh, not anymore. I practice, and and it is a part of the management.
Yes.
These days we have to accept and admit that social media has a very crucial role.
Key role.
Key role. Right. So we live in 2 universe at the moment. One as a picture in front of camera, the other one physical, regular life, right?
True.
So we have to merge them together and connect them together. And recently I started working on social media more, so I was lucky to find a good team, as I mentioned, like Nirvana and its service and other content creators in my team at my office to just send messages towards audience.
Wow, that's wonderful. So social media plays a constructive role for you
at the moment. Yes.
Amazing. Okay,
thank you.
Before we let you go, I just want to know, people often think dentists as they are denters, they take care of things. They don't have to go to do you ever have to go to a dentist as well?
Yes.
Oh, you also have to?
Yes. We are regular humans, and we we do the same, and I go to my routine checkups and cleaning at my office, and we have many amazing two amazing hygienists that help me with cleaning, and also other associates that helping me with checkup, and if I have any problem they would take care of it. So far at this office, I fixed only one tooth, one cavity.
Okay.
For 16 years. It's an
achievement. It's an achievement. Yeah. So tell me one thing. As you said this, you go to your dentist when your family has problems, maybe your wife and kid. Who do they go to? Do they come to you, or they?
Yes, they come to me. Actually, at BC, we are allowed as a dentist to work on a close family.
Oh, okay.
But there are other territories like Alberta that I've heard they are not allowed. So they have to go to other dentists. But in BC, fortunately, we are allowed.
So they're allowed, and they come to you, or they go to other dentists within your...
No, I'll take care of them. I'll take care of them, yes.
They believe in you.
They believe in me.
Thank you, Doctor. It was lovely interacting with you. Your thoughts, your compassion, your understanding of the business, and most importantly, the good human you are that communicated through your answers is really, really heart-touching. And I'm sure it will be learning for lots of people who are watching this podcast, watching these questions or watching these answers. I'm sure it will give them right understanding and ideas how to build the community, how to take the business forward. Thank you. I really appreciate it.
My pleasure. And I thank you, Vishal, to invite me. It was a very pleasure time for me. It was nice seeing you again. Every time I see you, I know you more, and you have a good soul, and I really appreciate that.
Thank you, doctor. Thanks a lot.
Thank
Pleasure
you.
meeting you. Thank you.